So I mentioned mobility at the beginning of the session, and mobility and study abroad is a core part of a medical student's journey here in Galway, and it's something that, well, I guess Dave and I are very proud of, as we're involved in facilitating a lot of these international opportunities. So I'll share some insights into what this looks like here in Galway. So all of our medical students spend 1 calendar year in a regional academy. And this is a unique structure to the University of Galway. So we have 4 regional academies based along the west coast of Ireland. So you'll see our little map on the left-hand side. So we have academies in Donegal, Sligo, Mayo, and Ballinasloe. And they're all located along the western seaboard. Students move to these academies, and this is where students get to interact basically on a one-to-one level with patients. The groups and the teaching is small, so you're getting one-to-one tuition and one-to-one supervision from your supervisors and your registrars, senior house officers that are located in these hospitals. You get access to urban and rural clinical exposure, and this is really, really important. So Galway, the hospital in Galway would be defined as an urban hospital, given that we're based in a city. So when you move to an academy, you get access to a different type of medicine and a different type of patient. And this is what we call rural medicine. So it's nice for students to be able to get access and experience in both of these areas, as it might influence your career plans later on in life. The close proximity of teaching and clinical facilities is another really, really great point about our academies. So all of our academies, including the University of Galway campus, are co-located with the hospital. So basically, a student can be at a lecture from 8 to 9 and be in the hospital environment at 9:05, ready for their clinical training. So it's very important. There's no commuting. There's no kind of running back and over across the city. You're based, co-located in the one area with a very short walk between your clinical and teaching facilities, which is really, really great. Just a few pictures of what our academies look like. They are basically mini versions or satellite campus of the main university campus. So they're fully functional. They have all of the same facilities, teaching, student support, everything that's in Galway is based in our academies as well. So some students are a little bit worried at the beginning about moving to an academy. And when we talk to them, when they return to Galway, more often than not, they tell us it was the best experience so far of their medical education. So that's something you can hopefully look forward to. So mobility. So we have mobility within the program, but we also have mobility at different junctures throughout your medical education. So I'll talk from the bottom up. I'll talk about our Erasmus program first. We run the largest Erasmus program in a medical school in Ireland, and we have 7 partner institutions across Europe. We have 2 in France, 2 in Germany, 1 in Switzerland, 1 in Sweden, a partner in Spain, and also a partner in Italy, coming on stream for 2025-2026. This Erasmus program is open to all students. Now, there are some language requirements which, students would have to adhere to, but we also have some English-speaking partners. So if your second language is English, there are opportunities for students to participate in Erasmus as well. But if you do have German or French in your language portfolio, it's a great opportunity to spend 3 months in a partner medical school across Europe and then return to Galway to finish the remainder of that academic year. Summer electives are really, really important for international students as well as our local domestic students here in Galway. This is where you get to experience an area of medicine that you're particularly interested in. So you might be interested in cardiology, pediatrics, obstetrics and gynecology, but you might not have had enough exposure on the program to make a decision on whether this is the career path you want to follow. So summer electives are a great way to get some experience of an area of interest or an area that you want to try out before committing to it as a career choice. So we have a very well developed summer elective program, and we also allow our students to travel internationally as part of their degree in the clinical years. So you get to go back to your home countries or to any international location for 3 weeks, completing a clinical elective in an area linked to the medical school curriculum in Galway. So another really, really great way to diversify your interest, develop your employability, and obviously build your clinical skills and knowledge as well.